Hello everyone. Today we are going to discuss about an important disease in neurology called SYRINGOMYELIA. And actually this SYRINGOMYELIA is actually on its own is rare, but it is very important disease actually. So it worth talking about. So now we are going to see the definition, then the cause, then the signs and symptoms, then some treatment actually. So that is it. So this diagram we are seeing is a kind of actually schematic diagram the uh, of the spinal cord at the level of cervical vertebra actually. So this is at the level of the cervical vertebra. So this is the fluid inside the spinal cord. So that is it. So now we are going to dive in. So syringomalia actually. So what's the definition of syringomalia? That's the definition. So actually, by definition, syringomalia can be defined as a disorder in which there is formation of a kind of cyst inside the spinal cord itself. That's within the spinal cord, not around the spinal cord, but within the spinal cord. That is disorder in which there is formation of a cyst within the spinal cord. So within the spinal cord actually. So this is the definition of the syringomalia. So that is it. That's within the spinal cord. So now we are going to see the causes. So what causes this cyst to form within the spinal cord? And this cyst is also known as a kind of syrinx from the word syringomalia. So it is also regarded as syrinx. Syrinx. So this cyst is also another name. That is the accepted term that is applied to the syringomalia. That is applied to the cyst that develop inside the spinal cord actually. That's called syrinx. So that is it. So this collection of cysts is forming actually in the central canal of the spinal cord. As we have already known that if this is a spinal cord, there is a central canal actually in the center, in which the central canal is filled with actually cerebrospinal fluid. So this is the central canal. So the syrinx actually develop mostly in the central canal of the spinal cord, and it is forming actually mostly in the cervical region of the spinal cord. So that is it. So now we are going to see the etiology, that is the causes. What causes this syringomalia actually? Number one, and the most common cause is congenital abnormality or congenital anomaly. So this congenital anomaly, actually the most common form of disorder that causes this congenital type of syringomalia is called Arnold-Chiari malformation. Arnold-Chiari malformation. And in this Arnold-Chiari malformation, actually, in the posterior fossa of the cranial fossa, that's the posterior. Let us see the diagram actually. This is it. This is a diagram. This is the cranial fossa. This is sphenoid bone, frontal, and whatsoever. This is the posterior fossa. So this posterior fossa, there is malformation in this Arnold-Chiari malformation actually. This is underdeveloped, and we have already know that the cerebellum sit in this fossa actually. That's the cerebellum. So when this fossa didn't develop well, that is there is no room for the developing cerebellum, right? So that this cerebellum will herniate, especially the tonsils of the cerebellum will herniate through this foramen of magnum. And we have already know that spinal cord pass through this foramen of magnum actually to meet with the cerebral hemisphere, or to say to meet the brainstem actually before the cerebral hemisphere. So when there is no room for the cerebellum, then the cerebellum will herniate down here. When it herniate, then it will compress the spinal cord. When the spinal cord is compressed, so this central canal of the spinal cord is also compressed, right? So if this central canal is compressed, actually then there will be formation of that kind of syrinx actually. So there will be formation of this kind of fluid. This fluid will collect in the spinal cord actually. So that is it. So this is what is happening in Arnold-Chiari malformation. And the associated symptom of Arnold-Chiari malformation is a symptom of increase in intracranial pressure, right? So mostly you will see them with vomiting. You will see them with severe headache actually. And then mostly this anal cavity malformation is associated with hydrocephalus because there is compression of the circulating cerebrospinal fluid, right? So it may lead to hydrocephalus actually. So that is it. And then actually this anal cavity malformation causes this syringomalia mostly around 25 to 40 years of age. That is around 25 to 40 years. 40 years of age actually. So this is actually where you will be started to experience the symptoms. That is the patient will started to experience the symptoms actually around the 25 to 40 years of age actually. So that is it. So the next uh, cause is actually acquired. It can be acquired. If we have congenital, so we have the acquired actually. So the acquired causes of this is due to complication of meningitis, then a kind of trauma, then a kind of hemorrhage also. So in this actually in disorders or in these pathologies actually there is formation of this also cyst in the spinal cord. So that's why sometimes they regard this congenital anomaly as non as communicating, while this acquired known as non-communicating. So that is it. So now we are going to see the symptoms. So before we actually see the symptoms, we have to really see the section of the spinal cord. If this is the spinal cord in section, this is right side, this is left side, this is right hemisphere, this is left hemisphere. So we actually have sensory fibers that is carrying temperature and pain sensation from the limbs actually and whatsoever. So when they come through the dorsal horn of the spinal cord, as they enter the spinal cord actually they cross to the opposite side. So as they cross to the opposite side actually, so they go then meet with the thalamus and then finally reach to the hemisphere. While the fibers from the left side of the body, that is the fibers that are carrying the temperature and then the pain sensation, then they also come here and then go above, then meet with the uh, right hemisphere. So this means pain sensation and then temperature sensation from the right side of the body is actually translated in the that's contralateral. That is the pain and the temperature fibers that are carried from the right side of the body. Actually, they are connected with the left hemisphere and then vice versa. So that is it. So this is called dorsal. The fibers that are traveling through here also, they used to cross at the level of medulla oblongata, especially at the level of a bit above the level of the medulla oblongata. So these fibers are actually carrying sensation of vibration, as we have already known sensation of vibration and then sensation of proprioception. So this is the function of these fibers that are carried through this actually. So they didn't cross immediately in the spinal cord, but they cross at the level of the brainstem. So that is it. But while the fibers that are carrying temperature and the pain, they cross immediately in the spinal cord. So that is it. So when this cyst develop inside this central canal, so this cyst will going to destroy this connection. So if this connection is disturbed, let me use another color. If this pathway is disturbed actually, so this means the fibers that are carrying temperature and then pain sensation are going to be what? Are going to be destroyed. When they are destroyed, then the patient will not be having sensation of temperature and then the pain in the both side of his body, because both of the fibers in either side of the body are actually destroyed, right? So that is it. While the fibers that are here are safe, that is the dorsal column medial lemniscal system. They are actually spared, so they are normal. They are okay. This mostly, in most of the cases, if not all the cases, this cyst or these syringes that develop didn't actually affect the fibers that are carrying the vibration. So that is it. So now we are going to see the symptoms, and then in this side there are fibers that are coming, that is the descending fibers that come from the cerebral hemisphere. They also cross at the level of medulla oblongata. So these fibers, they are the fibers that are actually called lateral. These fibers are called lateral corticospinal tract because they develop from what? From the cerebral hemisphere, that is cortico, then to the spinal cord, that's called corticospinal tract. But they are in the lateral side, then called the lateral corticospinal tract. So the function of this is not to carry sensation, but to make our limbs move, right? So that is it. So they make our body to move, especially the limbs, actually, the lateral corticospinal tract. So that is it. So these are also sometimes affected when these syringes or when this cyst expand to some extent. When it expands, because over time this cyst is expanding and then elongating. So over time it is expanding, mostly literally. When it is expanding, then it will destroy also these fibers that are actually communicating with our limbs, that is upper, especially upper limbs, and then causing this upper limb to move, actually. So that is it. So when these are destroyed by the expanding cyst, then the limbs can undergo actually paralysis. But this definitely occur later in the disease. But mostly, no matter how little the cyst is, these are going to be affected because they cross along the way of the uh, central canal, actually, and this cyst is forming in the central canal. So that is it. So now let us see the symptoms.